Case is 71 years old man. He has 5 kilogram weight loss since February 2015, and CT scan and MRI revealed a cystic lesion in 3 centimeter of the uncinate process of the pancreas. And the patient is scheduled today for US evaluation with Dr. Comanduri and Dottoressa Petrone.
So what I wanted to just show you first is we're in the stomach imaging the body and tail, and what you can see kind of nicely here is a normal caliber pancreatic duct here, some normal parenchyma. You actually can see the ventral and dorsal ducts, which is kind of a nice anatomical view here. So I just want to give you an idea, and there's some side branches that we're seeing there as well. So maybe a little bit of, but I don't see any frank features of chronic pancreatitis. So we'll go down. And so this cyst is in a little bit of a tricky place, as you can imagine by the imaging. And so we'll start here, just imaging the head, and you're seeing the common bile duct and the pancreatic duct here. Again, looking fairly normal in caliber, maybe up 2.5 millimeters on measurement. So as I push the scope in and go into a longer view here, you'll start to see the lesions of interest. So it's a multilocular. There's probably about 4 or 5 cysts there you can appreciate. Very simple appearing. No evidence of any mural nodularity. Frankly, nothing alarming that would think this is causing his weight loss. If I take you down towards the second portion, we get a look at a fairly normal papilla. It's a little bit of unstable position here, so I'm going to try to show you from here as well. And there you can kind of see a better view. So in the uncinate process here, so the question becomes, he's 73 years old, he's got weight loss, and he's got these very simple appearing lesions in a fairly tricky place, which would require a Whipple if we found anything. What does the audience want us to do? It's the last case, you guys get to pick.
Well, you haven't found any worrying features, have you?
No, there's nothing worrisome. There's no nodularity here.
Maybe the dimension is a worrisome feature. Is more than 3 centimeters or not?
Yeah, so we
Yeah.
can. Can you freeze that? Sorry, freeze.
Okay.
Was the patient symptomatic, or was it just weight loss?
Just weight loss. You measure. We're going to measure it here and just give you a global.
Yeah.
You can kind of see the PD entering in there, so this probably has some mucinous. But again,
Yeah.
so we're at about 2.4 centimeters here.
Yeah.
So technically, especially.
Should we have an audience vote?
Have an audience vote.
Okay, so who would FNA this, one of these or all of these cysts at this stage? Hands up, please.
I don't know if all of them is on the table.
About a quarter of the audience. And who would stay out with a needle and move over to an MRI surveillance? Not that I'm suggesting that. Oh, not so many, actually. Bit of a mixed answer. Anybody got any other suggestions about the way to proceed? Any other things we could do? No. Yeah. So I think everybody agrees that this is unlikely to be related to his weight loss. And
So we're taking
keep
a
going
poll.
on finding why.
Audience poll for the last case. What does the boss want?
We got Julio would like to ask a question. Could we have a microphone for Julio behind you?
Okay, this is Julio from the audience.
Hi.
I just have a question regarding IPMN.
He's not a real one. He's planted in the
Well,
audience.
I'm not a big finger. I'm trying to do my best. The point is, I think one of the points that we need to improve our diagnostic ability in IPMNs is to try to determine which subtype, histological subtype of IPMN it is, because we know that the size worrisome features can be useless if we are working in a really pre-malignant IPMN with an histological subtype with high probability of malignancy. So in my setting, I will not make a biopsy today because of the weapons that we have available today to try to optimize the diagnosis. But if we really have anything that can lead us to determine which histological subtype, for sure I will make a biopsy in all of these cases.
Okay.
So, plan?
I think
What's not correct?
it's probably a side branch
Yes.
with no mural nodule, no malignancy sign in the MRCP. I think you have two options: is to follow the patient, and I think for us there is no indication of biopsy because, as you know, the CA level is not predictive of, and we have the risk to have a leakage of liquid in the peritoneum cavity in this case, and I think it's very important to know if there is mural nodule or not.
Yeah.
In this case, there is no mural nodule, and we follow the patient. But this is not the cause of the weight loss, and it's probably we should do other examination for
Okay.
this.
One question.
Yep.
For this side of the lesion, which follow-up you propose?
Which follow-up we propose?
In the States, which follow-up?
So across the sea, we would follow up with MRI. I think with a symptom of weight loss, maybe first one in 6 months. And then at some point we decide, maybe one or two more exams. If no change, then
Fully agree.
we stop.
The same. Fully agree.
Just for MRI, or maybe US in 1 year?
Yeah, I don't do another EUS unless there's some change on the MRI because I'm going to do the same thing here, which is do nothing.